Hey guys, Coach Britt again, and welcome to Mod 3 in our How to Become an Elite Health Coach course. Right now we're going to talk about what are the qualifications that you need to become a coach. A lot of people wonder this, and it's really ironic because while we need qualifications, in traditional degrees for many things, from doctors to registered dietitians to, in a lot of states, dental hygiene or dental assisting even, and things like that. Health coaches actually, amongst the US and in most other countries, do not need any technical qualifications to call themselves a coach. Anybody could tomorrow have absolutely no training, no education, and call themselves a coach. So why the heck would you pay for something or take a training when anybody could just be a coach? And that's a good question. So it actually comes down to validity. So here at our school, we are AADP accredited, which means we are accredited by the American Academy of Drug List Practitioners. Now, what this does is it's a body of validation for us, for our trainings, and to our clients, or to our coaches and our potential students. And all of our coaches then qualify for AADP board certification, even those outside of the US, because frankly, it's the credentials that speak volumes to your client. Because we are operating in a world, there's two big reasons here why certification can help you. If, and only if, you pick the right programs, because you can pick lousy programs and have lousy training that, and get really not much information out of it, and get a certificate and call yourself a coach. And that will give you one thing. It will give you a body of validation. It will give you a certificate that validates you've had training in something. And people want to see that. It doesn't really matter. They don't really know the difference between schools. Honestly, your clients don't. If anyone asks you what school you went to, generally they are another coach, or they're someone in the wellness arena. They're not a client or individual unless they're looking for a degree program and they're asking about a university. They're usually not a client. But they just want to see the validation. They want to see that you've been trained in this area that you're presenting to them, in this business that you have as the professional that you are presenting yourself to be. So that validation is really beneficial in selling yourself. You don't need it, but I'll tell you what, the coaches that do really well usually almost always have it. Now, the next reason is to have a method for training. One thing that we've noticed in people, we have a lot of coaches that come to us to train as students that are incredibly self-educated. They know a lot of information, especially in the realm of gut health, which is the advanced level of nutrition now. It's up and coming. It's going to continue to be growing, and we're going to grow in our areas of knowledge with it as time progresses. But what they do is they might have a ton of education, but what we all struggle with, those of us who are big researchers, those big book readers like we talked about in the last module, is we take all that information and our heads just exploding with a million things, okay? And we don't know how to actually apply it with a client in a step-by-step way. And so while hopefully you'll still always learn more information in your program, having a program to not only validate you, but to lay out fundamentals of how to actually go about this and working with clients and how to actually go through steps and do these kinds of things is really, really critical and important. So that, like I said, you do not need to be trained as a health coach in order to coach. But it's really something to think about. In the later modules, this one's going to be kind of short today, but in the later modules, we're going to talk a little bit more about what to look for in a program, because if you are going to invest in something that's going to give you something back. So we're going to talk about that in a couple modules. But for now, we're going to cut this one short, and now you know. So those of you who have wondered, what qualifications do you need? We actually train people who are trained doctors and nurses every day, medical professionals who are, advancing into new areas, especially like in the UK and London, where they're a little more progressive minded they're a little more advanced, honestly, in their medical community there, and how the services that they use with their client and their patients. But and then we train the brand new person who just thinks about it, who doesn't really know, and who just doesn't, you know, they think that, oh, maybe they need this and this. You really don't need anything to start except for a willingness to learn. And I know as far as our programs go, we start from square one. We go from A to Z with it. So we cover the basics, and then we go, you know, farther into all the important information. So this module is a little shorter today, but we will see you in module 4. We are going to be talking about keeping clients motivated. So what are your qualifications? You know, you don't need them. You can start from scratch, but how do you actually work with a client? What if they don't want to do anything? Blah, blah, blah. We'll talk about that in the next mod. So I will see you in module 4.